Good morning guys, James here from Vitality Chiropractic Australia. You'll have to excuse my voice, I'm sorry. I am a little bit nasally today. I've woken up just a little bit under the weather, but we're going to power on and have another good day at the practice. I did want to have a brief chat about a condition which is called shoulder impingement syndrome, and something that we're starting to see more and more of in the practice. Not sure why, but we are. So what is shoulder impingement syndrome? Well, shoulder impingement syndrome is a condition whereby the muscles or tendons or ligaments of the shoulder become irritated or compressed during various shoulder activities or movements. So some of the common signs or symptoms which you may experience are things like generalized shoulder pain. Perhaps you're noticing just a general achiness of the area. Of course, you may notice restriction of movement, particularly movements above your head create a level of discomfort or pain, and particular activities or things like buttoning up a shirt or putting a bra on may be more difficult. So there's some of the common signs that you may be experiencing shoulder impingement syndrome. In terms of treatment, treatment is, of course, it's very dependent on its case-by-case basis, but some of the strategies which I guess we broadly use, shoulder mobilization techniques to improve its movement. So we may be able to use things like on our table in the clinic we have what's called a drop piece, which is it's a dropping mechanism on the table whereby we can put a force through a joint to improve its movement. So we can mobilize the shoulder that way. We can do various other mobilization techniques, sort of more hands-on stuff. We can massage to the surrounding structure of the shoulder. So, for example, the rotator cuff muscles, we can reduce spasm and tightness in those. We can also facilitate or improve healing within ligaments and tendons of the shoulder. Ultrasound applications are a really good one as well. It does reduce inflammation within the joint capsule, subacromial bursa, the bursa of the shoulder as well. So ultrasound, as I said, reduces inflammation, improves healing, and therefore it's going to improve your movement. So there's some of the techniques which we use. Why does someone experience shoulder impingement syndrome? Well, I guess typically there's two causes. One is what we call primary, or two categories I should say. One is primary category, which is you may have a structural change in the shoulder. So you may have a smaller, what's called subacromial space, which is the space just under here. If that space is smaller or narrower, then it will impinge on those muscles easier, and therefore it may develop into shoulder impingement syndrome. Category 2 is what we call secondary causes. A really common cause which we're seeing more often is what's called poor posture or proximal cross syndrome. So that's usually where you see the person who has that rounded shoulder type posture. When someone's shoulder rounds forward or moves forward, again it compresses on that subacromial space. So treatment of those sort of individuals is really targeted at improving someone's posture, so improving their thoracic extension and the strength of their posterior stabilizers of the shoulder, which will facilitate improving their shoulders, drawing them back, and enhancing the space of that subacromial area. So that's a bit of a background of shoulder impingement syndrome. If you'd like any other information, please give us a call. Our phone number is 1300 003 777. Alternatively, you can schedule appointments online via our website. Have a great afternoon and we'll talk to you soon.